for most of our lives, when we think of psychedelics, we've thought of hippies, LSD, party drugs, adjacent to music and art, and the fact that it's illegal. As Sam explained to us, in the 1950s, psychedelics were discovered in the Western culture and were actually explored as psychiatric medicines, and they were showing a lot of promise, but then that got shut down by the Nixon government's war on drugs. More recently, some of us have maybe been exposed to psychedelics through pop culture. Maybe some of you have read Michael Pollan's book, have heard about microdosing and its benefits to boost creativity, especially in top tech entrepreneurs in Silicon Valley. And here we are in 2022 in a pub talking about psychedelics. So what's happened? Who here likes numbers? How many? Okay, these are easy numbers. Almost 1 in 2 Australians experience a mental health disorder in their life. 1 in 8 Australians use antidepressants, and only about half of them get a clinical benefit from it. And Australia is the second highest rating nation in the world for using psychedelics. It takes about 1 month for antidepressants to start working, and during this time, your doctor will tell you that it might get worse before it gets better. 8 Australians take their lives each day, and the cost of mental health in Australia every year is $220 billion. That's like $50 to $60 million a day. These are some pretty harrowing facts. And this is what's sort of prefaced the re-emergence of psychedelics as a treatment. So the last real discovery in psychiatric medicine was about 50 to 60 years ago. And since then, we haven't had much. And as Sam said, it costs $1.2 billion to get a drug to market and takes about 12 to 15 years. So during this, half century, rates of mental illness are going up, substance use is going up. It's some dire times. We've been living through the dark ages of psychiatry. And in that time, people have started looking around, desperately, what can we use? What else is out there? And people have realized, hey, these psychedelics were looking pretty good. That desperation, along with these sort of changing attitudes towards psychedelics, we've got these reputable people talking about psychedelics in a good light. And things like medicinal cannabis being legalized, these changing attitudes created an environment that facilitated the research of psychedelics. So psychedelics started being researched again. Here are some other numbers. 1 to 2 treatments with psychedelic-assisted psychotherapy can cause large reductions in symptoms, about 60%. They're effective in a high proportion of responders, 60 to 80%, and especially in treatment-resistant patients who have tried everything and nothing else has worked. And they work quickly. We're seeing results in, a day. And in some reports, they're having effects that last up to 12 months. So these are quite promising. And it was this data that caught my attention. So I'm a neuroscientist by training. I was passionate about mental health. Tried to get into mental health research in my honours year and was just disappointed with where we were at. I was saying, as a pharmacologist, there's been no discovery. The best tools we have are surveys. And I was like, oh, that's a shame. So I switched into medicinal cannabis, and that's been a really fun, wild ride. And it's actually been preparing me for this, which is amazing. So this caught my attention, and I guess along with, COVID really made it prevalent how problematic our mental health system is. And last year I lost 2 friends to suicide. So it was right timing, everything's coming together. And it was results like this. So this is 4.5 years after someone participated in a psilocybin therapy study. They said that it was one of the most meaningful experiences in their life, comparable to the birth of a child or death of a parent. And this is 1 to 2 treatment sessions. All right, let's do some 101. What are psychedelics? So psychedelics are described as consciousness-expanding drugs. The most popular types are LSD and psilocybin from magic mushrooms. They can be naturally sourced from mushrooms, plants, or animals, or they can be made in a lab. MDMA and ketamine also fall under the broader umbrella of psychedelics, although they're not true classic psychedelics. Psychedelic effects. So some people may know, or I guess they've heard about the psychedelic effects, the hallucinations, but aside from that, you get distorted perceptions, and synesthesia, which is a crossing of your perceptions, which are things like hearing colours or smelling noise. You also get, so this is while the drug is active in your system, you also get sort of this loss of coordination and disorganized thoughts, and then your mood can be, on either end of the spectrum, euphoric or detrimental, and you can experience those at the same time. Additionally, at the brain level, we see increased neural connectivity, increased neuroplasticity, which I'll go into, and quieting of the default mood network. And psychologically, the use of psychedelics allow people to gain insight that alters their self-perception, increases feelings of connectedness, emotional release, and psychological flexibility, and increased learning. So together, it's setting up this environment for a therapeutic effect. So it's very, 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 very important to note that those effects we're seeing in those studies aren't just from psychedelics, it's from psychedelics paired with psychotherapy. Now, what is psychedelic-assisted psychotherapy? So it's where you flank the psychedelic drug-taking experience on either end with therapy sessions. So therapists will prepare a participant for the treatment after some careful screening. And then there's a drug dosing session where you take the drug, and it'll last maybe like 6 to 12 hours, and you have your eye masks on, you have your headphones on, you're in a comfy room, and you have 2 therapists supervising you. And then afterwards, you have integration sessions, and this is where a lot of the work happens. You go over what was experienced in that drug dosing day and work through things. And sometimes the drug dosing and integration session is repeated. So the therapeutic areas being explored for psychedelic-assisted psychotherapy are terminal illness-associated emotional distress, so anxiety and depression, post-traumatic stress disorder, depression, anxiety, and substance use. Here's some data. So this is one of the more recent studies, also by Carhart Harris. He's a big leader in the field. So it's where they compared psilocybin to a common SSRI antidepressant. And as you can see, on the left we have your depression scores, and you're seeing a rapid decrease in depression scores, and that's sustained after 1 to 2 dosing, while the SSRI users are taking it every day. And then with the well-being scores, you see an increase in well-being. And these are quite acute. They stop at 40 days. But what we're seeing generally is these effects are lasting. Okay, and it's this data that has supported the progression of these drugs through drug development. The FDA, which is the American Regulatory Body, needs to approve drugs for certain indications for them to become available. So your doctor can prescribe them and you can get them sort of reimbursed in insurance. So the MDMA and psilocybin are at the breakthrough therapy stage. They've been granted breakthrough therapy status by the FDA, which fast tracks their drug development because they're showing so much benefit compared to what's out there for indications that are difficult to treat. S-ketamine has been fully approved for the treatment of treatment-resistant depression and major depressive disorder. So we've got these drugs that are showing benefit for multiple different indications. The ones I've shown you, there are others as well, like it's being explored for things like dementia, fibromyalgia, headaches. So how are these drugs having effects on so many different areas? So when you take a drug, a psychedelic, it enters your body, goes into your bloodstream and flows into your brain. There, it interacts with these biological locks called receptors. So these locks can be activated by different keys. Serotonin is one of those keys, LSD is one, psilocybin is one. So once those biological locks are activated, we see these different cascades of intracellular events that Sam was talking about that cause different things to happen. And the effects that we're observing on the outside are increased connectivity in the brain, increased neuroplasticity, and of course the psychedelic effects. All right, a little bit of neuroscience 101. We've got a human brain here, and all the different colors are meant to represent different regions of your brain. And here we have neurons, which are your brain cells. And so a lot of people think of the brain as, this big fat lump, but it's actually made up of billions of little neurons like these, and they're connecting to each other, they're talking to each other. And these are in your brain, but they also go throughout your whole body. So if I want to raise my arm, my brain is sending a signal to my arm, and that's just a series of neurons talking to each other. This is super cool. So this is a image from a microscope of the hippocampus, and here you can actually see the different cell bodies and the projections coming off them. So you can see they're all bundled in there talking to each other. And here's another representation. This shows you it's just an absolute mess, It's tangled wires, but your brain is able to make sense of them. So yeah, this is just lots of different neurons imaged, and this is actually a fly brain. All right, so your brain is really good at being efficient. It will find any shortcut it can. As I said, it's trying to communicate these complex, thoughts across these insane landscapes all the time. So it's going to be as efficient as possible. Think about if, when you were learning to drive a car. There is so much going on. It's so difficult. But now you get from point A to B, and you weren't even there. You weren't conscious. So it's these automatic processes that your brain drives to function, and they're really good, but they can also be detrimental. So we see this particularly with mental illness and substance use disorder, where by walking down the same paths, your brain starts to etch these grooves and these deep grooves, and it's really hard to take a different path. And the more you reinforce a pathway, the harder it is to build a new pathway. Also, the younger you are, the easier it is to learn and switch. But the older you become, the more inflexible and rigid your brain becomes, and the harder it is to forge new paths. Just reiterating, your brain is really good at filtering out noise it literally loves to jump to conclusions. So these little dots on the outside, these little circles of different colors, they represent different regions of your brain. And this is a graph representing neuroimaging data of connectivity between brains. It's just measuring brain activity and connection between different brain regions. And the paths that we see represent connections between those different brain regions. So this is quite an efficient brain. When you give someone psilocybin, you're getting insane cross-connectivity between the brain. It's like a carnival in there, but it's allowing your brain to communicate across regions that haven't talked to each other in a while, or forge new connections, which is why you can, smell music and taste color. This is another way to represent this concept. So if you think of your brain as a landscape and different regions are trying to talk to each other, in someone who is depressed, that brain has hills and deep valleys. And it's very difficult for your brain to walk across these valleys. And these valleys kind of represent fear and inhibition and processes your brain has developed to protect itself. What psilocybin does is it flattens the neural landscape for better cross-communication while it's active in your system, and then these effects remain. And this is what the patients report from the study. So this is a study where participants quit smoking after doing a psilocybin therapy session. I think up to 60% quit, and they remained in remission. And volunteers described achieving a new distance on their own lives, a new vantage point from which they were able to make better decisions or new decisions. This is a quote. You know how gargoyles look, crouched down with their shoulders hunched? That's how I felt and saw myself. It was powerful and disgusting. I can still see it now, that hideous coughing gargoyle, whenever I picture myself as a smoker. That's how the smokers saw themselves after the psilocybin therapy. It changed their perspective on the situation. Or more simply put, smoking became irrelevant, so I stopped. So psychedelics make it easier to form new neural pathways, and these are being described by the experts as shaking the snow globe, a reboot of the system, a cognitive defibrillator. And the way it's able, in that picture I showed you before of the 3 landscapes where the effects of psilocybin remained, they think this is through increased neuroplasticity. So neuroplasticity is a term used to describe how plastic your brain is, which basically just means malleable or flexible, because when plastics were invented, you could melt them, put them into a new form, and then they set. And then you can melt them and then change them into a new form, and then they set. So this is your brain's ability to make new connections. And as you can see, as I showed you before, the neurons are literally talking to each other. They've got these little feet that just overlap, and as Sam showed you, you've got those synapses that are cross-communicating. So when you take psychedelics, it literally forms new branching on those neurons. And people with depression have fewer branching on their neurons. So it's so much harder for them to form new connections and learn new behaviors. So psychedelics are powerful tools that make the mind more flexible. And when you pair them with psychotherapy, the mind is able to change and form new habits. However, there are limitations. This research is early stage. These studies are limited by highly selective cohorts, small sample sizes, and challenges with controlling and blinding. So normally, when you conduct a study, they're placebo-controlled trials. You get a group of people, you split them in half. Half get one treatment, the other half get another treatment. No one's supposed to know what treatment they're getting, so you can do a fair comparison. When people take psychedelics, they usually know they've been given psychedelics. So this is a fundamental issue that needs to be overcome for this research to progress. And psychedelics aren't for everyone. There are exclusion criteria with people who have a history or potential for schizophrenia, and it will be ineffective in some. And I really need to highlight the importance of set and setting. I don't have time to go into it in detail, but what psychedelics are doing is they're making your mind flexible, malleable to change. It's the psychotherapy that's making it better, but if you're in a bad environment, then you can induce bad change that's long-lasting. So I've talked about the psychedelic effects. They induce, increased connectivity, increased neuroplasticity. There are other events in your life that also induce this. Trauma. You have a traumatic effect, and that's ingrained in your brain for a long time. So it's that same effect. So I just really need to highlight that the therapy is such a big component of it. There are also other less detrimental effects that cause neuroplasticity and increased connectivity, and things like travel, meditation, scuba diving. It's putting yourself in this environment where you're forced to be present and all of your senses are activated. Yeah. So the story I'm telling you today is the tip of the iceberg. This is a new space and an ancient space that's existed for millennia. And there's so much work going on, so many different angles. And there are many challenges to having this treatment be available in mainstream medicine and accessible. This is conducting the studies to establish safety and efficacy. As I said, there's difficulty conducting this research. There's difficulty getting these studies funded, getting drugs in. The infrastructure, I don't know about you guys, but I had quite a few friends who tried to see a therapist during COVID. It's going to take 3 months. It's about a 12-month wait to see a psychiatrist. So these are issues that need to be solved before psychedelic-assisted psychotherapy can be integrated. Training and accreditation as well. We want to make sure the therapists delivering the training are equipped. As I said, your mind is susceptible. We want the right people in those environments enacting change. And then regulation, obviously trying to do research with a Schedule 9 drug has its issues. And then access and affordability. In the US, people can access psychedelic assisted therapy if you can afford it. We want to avoid that in Australia. We want it to be accessible to everyone. So while this looks like a long list of challenges, I see it as a roadmap. I see these as the steps we need to take to get psychedelic assisted psychotherapy developed in a safe way and then accessible to everyone. And then integrated into mainstream medicine. And this is already happening. As Sam mentioned, last year our government put forward almost $15 million for innovative mental health treatments, and a lot of that money went towards psychedelic studies. And this is a list of the psychedelic studies taking place in Australia right now. And it's like, there's so many there. And for numerous different indications. And it's not just Australia. Oh, cool. This is actually what psychedelic assisted research looks like. So on the left here, we've got my colleague, Dr. Paul Lichnitzky from Monash University, who's running the world's first Psilocybin trial for generalized anxiety disorder and Australia's biggest trial. And this is what the treatment rooms look like. You've got your 2 chairs for your therapist. It's a nice, cozy room. You can see the headphones and the eye folds. And this is what psilocybin looks like. This has come from Usona. This was meant to arrive before Christmas last year, and it came in last week. And it involved, 1,000% of the man hours it should have. So it's an expensive, slow process at the moment. But that's changing. So focusing on psilocybin, I went and looked at what are all of the psilocybin trials that are taking place across the world. And I think there were about 97, 96, and most of them were in depression. There's a lot happening in healthy participants, and just trying to figure out, what psilocybin actually doing. We've got to do all the groundwork to kind of understand what it's doing, what the safety is. But it's showing a lot of promise for substance use disorder, including alcohol, nicotine, meth, cocaine, opioids, headaches and migraine, health-related psychological distress, and this is sort of the anxiety and depression of being diagnosed with cancer, a terminal illness, or HIV. And then eating disorders, anxiety, and a few smaller ones. And this is all of the clinical trials taking place with psychedelics across the world. So the purple represents the studies that have already been completed, but the white ones are the ones registered. So it's a growing area, and there is so much hope. And it truly is the renaissance of psychedelic research. These are all of the scientific articles published on psychedelics. As you can see, there was a wave in the 60s and 70s. It kind of plateaued, but now there is a steep accelerating rise in psychedelic research, and that's because, as I said, there is desperate need. The culture is changing, and as Sam said, there is VCs set up specifically for psychedelic research. It's the right environment, it's the right time. The psychedelic revolution is coming. And me and my colleagues and a lot of people in Australia are working really hard to make sure the research is done properly this time, because it is our best hope right now for mental health. Nothing else has worked in the past 50 years. I'm really excited, and Australia is actually the best place for this. Quite interestingly, we're world leaders in clinical trials, and we have this massive hub of mental health expertise in Australia, and our government was the first government to fund psychedelic research. And we're really hoping that, how I said what psychedelics do to your brain, it shakes things up. We're hoping that that's what it can do to the mental health system. It can shake things up and rewrite the whole thing so we can develop a really supportive system, this supporting network of infrastructure that's going to help people get access to the medicine they need. Thanks. Questions? Yep. Yeah. How long until we think this will be put into place? That's a really good question. Technically, you can access psychedelics right now through special access schemes if you have a doctor willing to take the risk and get it done. Regarding mainstream, it's going to take a few years still because those studies need to be done. They're really big. The studies on psilocybin are not really being funded because they're not patentable. So while that's happening, it's these pharma companies riding through it simultaneously. It's really good that there's like a multifactorial approach. There are lots of people working on this to try and get whatever treatment through, and then once that's through, the others will flow through. Because when you think of antidepressants, there isn't one, there's multiple, because some work for some people, some don't. So realistically, it's going to be years still, but yeah. Yeah.
Why are there two therapists in the room and not just one?
Yeah, it's an interesting question. There are issues, or it's a safety issue, because these drugs can induce certain behaviors that could be, it's just a safety issue. It's to make sure that there are therapists taking advantage of patients, or patients aren't, if something happens, there's just support on board. And they're trying to move towards different models as well, because that's a really expensive model to have 2 therapists per patient. So actually, it's really cool. They're building these like hexagonal labs where you've got all of these labs on the side, and then you've sort of got an overseeing psychiatrist, and then you kind of have really trained support staff, and it's this big open space to try and make it more accessible. I guess you first.
So do you think it's mainly the subjective effects of the psychedelic experience that are causing the therapeutic outcomes, or are they mere psychoplastogens that are just working by reducing neuroplasticity?
Yeah, good question. We don't know. There's preliminary evidence from animals showing that they've got a really good model for psychedelics in animals, and when they remove the psychedelic effect, they're still seeing antidepressant effects. So it might be the other effects, but it could also be that the subjective psychedelic effects are facilitating that as well. An interesting factor is, though, along the way they measure your mystical experience, like how important was this experience to you, and the more mystical the experience is reported as, the more beneficial the effects are. So it's kind of one of those situations where it seems like the more you're open to it, the more you lean into it, the more you get out of it. Do you have a question? Yeah.
How does Australia compare to the rest of the world in access to qualified psychologists that can actually run these type of therapy sessions?
Yeah, interesting. I don't know the exact answer to that. We are behind though, but because it's not an approved treatment anywhere. But other countries are ahead in the sense that they're setting up, they're starting the training. There's maybe there's 1 or 2 sort of accredited training programs. That's part of the work we're trying to do, is we're talking to universities. We're trying to get this incorporated into psychological courses, develop post-grad courses, make sure it's just so ready in place, because it's not confirmed, but it's looking really good. And once that is approved, we want Australia to be ready to take it on board and roll it out. Is that enough? Are we ready for time? One more question? Yeah.
How much research is being done in regards to other drugs, maybe some cultural drugs like ayahuasca in Brazil, or even kava in the Pacific, for example? Is there expanded research in those areas too?
They are expanding. They're going to be much less to the classic psychedelics, which are like psilocybin and LSD. Psilocybin is the biggest, the drug that's being researched most, but those areas are growing, and you're seeing sort of cultural differences, I guess, between those cultures. I do see research from Brazil coming out where it is a lot more about that community aspect, and it's really nice to see so many people putting so much effort and integration into the sort of the indigenous traditional side of it as well, because there's so much wisdom in there, and they're trying to incorporate it and do it right. It's really nice to see this time everyone's learning from what happened in the 60s, and they're just really trying to do it right this time. Thanks so much for listening, everyone.